Welcome to this month's edition of OSU Extension Monthly. It's January and we are in the midst of our flu season. It's right now, everybody I talk to either knows somebody or they themselves have the flu. And this year's flu seems to be more serious and causing more complications for people than what we typically see in a flu season. I want to share today with you exactly what the influenza is, because a lot of people have a misconception about what flu is and what a cold is. I also want to talk about some treatment and some health habits that you can utilize to help prevent you getting the flu. And I also want to talk about how we can best prevent getting the flu. So, why is getting the flu a concern? Well, it's a concern because it can have some serious complications. Knowledge is powerful when it comes to getting the flu. So that's why we're going to talk about the flu today. So what is the flu? Well, influenza is the correct term. We have just shortened it to the flu, and it is an extremely contagious respiratory illness. It's caused by the influenza virus. The virus attacks our body by spreading through our upper and lower respiratory system. There's a difference between a cold and a virus, or the flu. Both are contagious viral infections of our respiratory tract. The symptoms are very similar. Both of them generally begin with a sore throat, sneezing, coughing, headache, and discomfort in your chest. With the flu, you're likely to run a high fever for several days and have body aches that you won't have if you just have a cold. You become very fatigued and weak with the flu that you may not with the cold. Symptoms of flu, they come on abruptly. So it's not like, one day you're feeling good and the next day, yep, you've got the flu. So our CDC, which is the Center of Disease Control, recommends that all people take the flu vaccine because of the concern that a severe case of influenza can lead to a life-threatening illness, such as pneumonia. And if you've ever had pneumonia, you don't want to have it. I have been there and done that, and you really do feel bad. As I said, the CDC recommends the flu shot. The vaccine can keep you from getting ill with the flu virus, and it can reduce the risk of flu-associated hospitalization, especially among our children and our older adults. The flu vaccination is the most important preventive step or tool for people with chronic health conditions. There are many reasons why the flu shot may not prevent you from getting the flu, because I've heard people say, well, I took the flu shot and I got it anyway, so there's no need to take the shot. That is a misconception. Even though you took the shot and also got the flu, it may have reduced the severity of that flu, it may have made you not be as ill, and it may have prevented you from having to be hospitalized. Not all flu shots work for all different strands of flu. There's over 100 viruses out there that can cause us to have the flu. They're typically labeled an A virus or a B virus. The A, and I'm going to have to look at my notes here, the H3N2 virus. That is the virus that they have discovered through research and studies that says that the vaccine will not be as effective against. So there are several things that affect what the vaccine will be able to do for you. First, if you're 65 or older, you tend to have a weaker immune response to your vaccine flu vaccine. There are many reasons why people in that age group really do need to be vaccinated every year. Because that is the age where there is the increased risk of serious illnesses, hospitalization, and even death from the flu. Secondly, while the effectiveness of the flu vaccine can be lower in older people, there are seasons when the vaccine can provide significant benefits. Even if the vaccine provides less protection in older adults than it might in our younger age people, we do understand that some protection is better than none at all, especially if you're in that high-risk group, which the high-risk group is those over the age of 65, children, and women who are pregnant. Third, the flu vaccine may protect against other serious outcomes like hospitalization or death or having pneumonia. So there are studies that show that the flu vaccine does serve some benefit. If you're really frail and elderly, hospitalization from the flu can signal a decline in your health, overall health, and can be there for years in advance as you age. So understand that if you're 65 and older, you are in a very diverse group. Some of you are a lot healthier than others for various reasons. And when it comes to medical care, some people have to seek more than others who are over the age of 65. And so your immune system is different. And so it is highly recommended that if you're over the age of 65, that you do indeed take the flu shot. So really, how effective is the flu vaccine in children? Because I think a lot of parents don't want to give their children vaccine. Well, it has consistently been found that you can get a high level of protection against the flu illness with children, and that level is even higher than that what we see among older or healthier adults. So children also need to take the flu vaccine. There has been a study that has shown that children who take 2 doses of flu vaccine the first season that they're vaccinated, that they do much better and have better protection from getting the flu. So flu is just one of those things that we don't think about how serious the condition can become rapidly. So one of the ways that we treat flu is with some antiviral medication. Now, not everyone who gets the flu really needs to take an antiviral medication. But a lot of us, when we get the flu, we feel the need to do so. And so if these things happen, then you really do need to take the medication. Only antiviral medication can treat flu illnesses. You cannot buy things over the counter or just take whatever you have in your medicine cabinet and expect that to help you with your illness. Antiviral medications are different from antibiotics. Antibiotics are for bacterial infection only, okay? Antiviral medications are not available over the counter. They are prescribed by a doctor. It's really important that antiviral drugs be used to treat people who are very, very sick with the flu. That is those people who are hospitalized and those who are at risk for getting severe complications from having the flu. If they have a high risk of medical condition, they also are eligible and need to take antiviral medication. But just because you have the flu does not mean that you need to have antiviral medication. So when you go to the doctor and he says you have the flu, but he doesn't prescribe something for it, don't get mad at him. He is doing what is highly recommended in the medical profession, that not everybody who has the flu needs to have medication. Sometimes all you need is to get some rest and take your water. But if you do take antiviral drugs that's been prescribed by your doctor, you need to make sure that you take them correctly, the way that they were you were told to take them, so that you will do better. If you have the flu, it's very, very important that you stay home so that you don't spread the flu. It is highly contagious. It's highly contagious for more days than you probably think. Be sure that you limit contact with other people whenever you have the flu. When you cough, you need to cover your cough. And if you have the flu, you're going to be coughing, and you need to cover that cough. There are several ways to cover your cough. One is to use Kleenexes. You can just cover your mouth and nose. You want to cover both whenever you use the Kleenex, whenever you're sneezing or coughing. And put your used tissue into a wastebasket. That way, it's not laying around contaminating surfaces. If you don't have a tissue, it's very easy to cough into your sleeve, your elbows, such as I'm demonstrating right here. See? It's right there. It doesn't spread all over the place. You never want to cough and sneeze into your hand. I realize sometimes you don't have an alternative. It comes on suddenly and that's all you have available. You don't think about using your arm and you do this. Well, if you do use your hands, make sure that you wash them. And we'll talk about hand washing here in a little bit. But if you can prevent using your hands, please do so. When you go into a doctor's office, be courteous to others and wear a mask so that you don't spread the disease or the illness. Those who are in a doctor's office may not have the flu, but they have other things, but their immune system is going to be reduced, and so they're highly likely to get the flu from you if you were to go into the office and spread the germs. So it's really important that you cover your cough and that you wash your hands often with soap and water. One of the ways that you want to wash your hands, and what's really important about washing your hands, is that you do it appropriately and do it long enough to actually kill the germ. So when you want to wash your hands, you need to first wet your hands and then use some soap. Soap and water is best. And when you wash your hands, you want to make sure that you wash the top of your hands, that you wash the insides of your hands, that you go through your fingers and up and down your fingers, because they can have germs on them just as much. Also, kind of work around your fingernails, the cuticles here, because they also can harbor germs. And to be effectively washing your hand, you need to at least be washing them for 20 seconds. And you may think, well, that's not very long, and it's not. But if you wash your hands, a lot of times we just kind of and do that, and that's not long enough. You need to actually take time to wash your hand and do it the length of time that is recommended, which the minimum is 20 seconds. For children, to get them to wash their hands that long, because We have a hard time sometimes with children just getting them to wash their hands, let alone wash them appropriately. So you might have them sing the happy birthday song or some kind of a nursery rhyme that lasts for about 20 seconds. And that way it makes it fun for them, but they also do it the amount of time that is recommended. Hand washing is really and truly the most effective way to prevent yourself from getting the flu after getting the vaccine. So there are certain times when you actually should wash your hands. One of them is before, during, and after preparing food. You know, you have known that probably, have heard that all your life, but sometimes we get busy and we don't think about making sure that we have washed our hands before eating food. If your children have been playing with their toys, if they've been out petting the dog or petting the cat, they need to make sure that they wash their hands. So anytime before you eat and sit down at the table to eat or go out to eat, you need to wash your hands. If you're caring for someone who is ill, you definitely need to wash your hands after you have taken care of their needs. If you have a cut or a wound that you treat, you need to wash your hands before as well as afterward. After using the toilet, always wash your hands after using the toilet. If you have an infant, a child that is in diapers in your home, you need to wash your hands after changing that diaper. Or if you clean up a child who you are potty training with, you need to make sure that you wash your hands. If you blow your nose, if you cough, or if you sneeze, you need to wash your hands. As I mentioned, touching animals, feeding animals, or doing anything around animals, you definitely need to wash your hands. If you handle pet food or pet treats, you should wash your hands. And definitely when you take out the garbage, come back in and wash your hands, because you could have picked up some germs along the way that might cause you to become ill. Okay. If you are sick, there are some good health habits that you should practice. And one of those, of course, is to wash your hands. Wash your hands often. If they get dry or chapped from so much washing, you can certainly use lotion to help you with that. You also want to stay home. I cannot emphasize enough the importance of not going out in the public when you are ill with the flu. Same thing with a cold, but you really do not wish to infect someone who has a weakened immune system by going out into the community. So if you need errands run, call a friend or ask someone to run that errand for you. If you have a job, most people don't want you to come in and make them ill either. So stay home from work, stay home from school, stay home from running errands, and that will help a lot to keep from spreading the disease. And you know, some of our schools have lots and lots of illnesses in them right now, and that's because kids have come back to school too soon after having the flu. Now, you need to wait at least 24 hours after the last time you had fever. Now, that doesn't mean that you take medication and that reduces your fever. It's when your body actually no longer has a fever. 24 hours after that. And I think a lot of times we don't realize that we have to wait that long. We feel like that, you know, we're taking medication, we're not running a fever, so we're not contagious, and that is not true. If you're taking medication for the fever, your body still has, you're still contagious to other people. So make sure it's 24 hours after you do no longer have to take medication to reduce your fever. I have a bottle of hand sanitizer here today, and a lot of people don't have access always to water and soap when you're washing your hands, so it is appropriate to use a hand sanitizer. One of the things that you must always be aware of is that you must check the active ingredient. You must have at least 60% alcohol in your product in order for you to be able to reap some benefits from using a hand sanitizer. The hand sanitizer is not a cure-all for not having soap and water. It's just another method, a tool that will help you along the way. When you use a hand sanitizer, you want to put it into the palm of your hand. And again, you want to make sure, just like when you're washing your hand, that you get on top, that you get it between your fingers, and you cover all surface area. It may not be as effective if your hands are greasy or extra dirty. And also you have to realize that swallowing hand sanitizer can cause alcohol poisoning. And so if you use a hand sanitizer and then you eat something that you handle with your hand, you may be at risk of ingesting enough alcohol that it could cause some problems with you. Hand sanitizers do not always remove chemicals or like pesticides or other heavy metals from your hands. So alcohol-based sanitizers are good. They can quickly reduce the number of germs or microbes that are on your hands, but they do not eliminate all of them. So it is not something that takes care of everything that you need for it to take care of. Another thing that you can do to help prevent the flu, or at least make it not so hard on you, is to have a healthy eating plan. To eat healthy. That means to get lots of fruits, lots of vegetables, do your whole grains, and make it fat-free and low-fat. Include lean meat, poultry, fish, beans, eggs, and nuts. Limit your saturated fats, your trans fat, excess sodium, and added sugars. We're about to come to the conclusion of this program today, and there is lots more information about the flu, but I hope maybe this helps you to learn some things and understand what you need to do to prevent the flu, what you do if you have the flu, and that you are a highly contagious individual if you do have the flu. I would like to promote a program that our OSU Extension Office is going to have in the upcoming month. It is the 5-State Women, and this year we're adding Men in Ag Conference. It will be a mini conference, meaning that it will take place in one evening. The event is January the 25th. It will begin at 6 p.m. in the ballroom at Oklahoma Panhandle State University in Goodwell. We will have a mini mall with lots of small businesses there. You'll be able to visit with those small businesses and others that are out in our community that can help you with your ag work, your production, what have you. We will have a dinner that will be provided that will include a variety of soups, some salads and sandwiches, as well as a dessert. We're going to peach cobbler and potato chowder and all those types of things. We do have a keynote speaker that will speak to us that evening. Actually, we're going to have two this year, which I'm really excited about. We've had Matt Rush at our previous Women in Ag conferences, and he will be back this year. He is bringing his lovely wife, Katie, with him, and we are excited to have them with us. Matt has a phrase that he likes to say, and he said, you know, life is good. Let's make it gooder. Now, if you look in the dictionary, you're not going to find the word gooder, but it really does embody what Matt is all about. He is an ag advocacy. He speaks internationally. He's been on television. He has, He speaks internationally, he speaks at Farm Bureau meetings, he speaks at all kinds of different venues. And we are so excited to have him coming to Texas County to be a part of our ag conference that is going on. We do have a charge for the conference. It is $20 per person. If you are a student and you would like to attend, that will be $10. If you pay in advance, it's $20, and if you wait to pay at the door, it will be $25. You can call us here at the Texas County OSU Extension Office. That number is 580-338-7300 to reserve your spot, or you can drop by and make your payment and we'll get you on our reservation list. If you need more information, you can contact me here at the Texas County OSU Extension Office, and I'll be more than happy to answer your question. And I really hope that you will come out and see, because you know everybody is involved in ag, and you will not want to miss Matt Rush and his wife Katie. They are dynamic speakers. They will really bless your heart and make you have a very enjoyable evening. Thank you, and remember, if you've got the flu, stay home.